Hi, I'm Dr. Beau.
I'm Dr. Dan.
And we are Two Fit Doctors. So I'm Dr. Beau Warlick. We're sitting here with Dr. Dan Levesque. And Dr. Levesque, tell us a little bit about your past, about why you have a passion to put out content.
Well, Beau, I started out in life as a skinny little dude, and I wanted to be bigger. I was really pulled by the Flex magazines, the Muscle and Fitness. Back then we had magazines, and I saw a guy with a huge arm, and I just, from that point on, I wanted that. I was ready to kill to get it. I don't know. I tried to do everything. And I did. That really started my life, sort of a road that I've been on ever since. And I started with bodybuilding. I had some frustration with that. I did a number of different shows. I could always get in shape. I loved nutrition. I loved dialing that in. I loved the challenge of getting in shape. But I never could seem to win any big shows because I was too small. No matter what, I was too small. So, that hunger never stopped. I went into chiropractic college. Professional career, decided chiropractic was the way to go for me. A lot of my people are medical, and for some reason chiropractic just made a lot of sense to me. After chiropractic college, I got kind of pulled into a gym that did a lot of powerlifting, and I met some of those guys, and I don't know, I started seeing that their training was more scientific than what I was used to. Not saying that bodybuilding is not, but I could follow it and measure progress and control things better with powerlifting. And so I did that. I got into coaching and competing and all that, and loved it. I did that for the majority up until I couldn't do it anymore. I probably did it for 15, 18 years, a long time.
Why could you not do it anymore? What held you back?
I realized with bodybuilding that I just didn't really seem to have the genetics to hold that kind of size that I needed. I ran into a similar issue with powerlifting. Apparently my knees were not designed to squat anything over 700 pounds, but boy, did I try, I'll tell you.
People are laughing right now as they're watching. Oh, nothing over 700 pounds.
Yeah,
for anyone that knows anything about weightlifting, 700 pounds is a serious squat for anybody. I don't care what your weight is. That's a respectable squat. But go ahead.
It was for me anyway. It was like my life goal. And then here my training partner squatted 1,000. Yeah. Mm-hmm. But I'll tell you, anytime I approached that number, I would break down. And I kept trying to do it until finally, slowly but surely, I just started having aching knees. My knees would ache to the point where they would just never stop. And then the pain kept getting worse and worse. Pretty soon I was hobbling around. Pretty soon I couldn't hardly walk. Pretty soon I couldn't hardly train. Pretty soon I was even having trouble being a chiropractor. So I thought, I don't know about this. I knew that I was going to have to get knee replacements. I got some x-rays done. They were bone on bone. I was like 40 at bone on bone with bilateral knee replacements.
Not a good prognosis.
Yeah, they only last so long. I didn't know what I was going to do. So I thought
I would have to have 5 knee replacements in your lifetime.
Right. Yeah. Yes, they wear out.
I think they only allow 3, by the way. But go ahead.
I wasn't willing to go there. Something about it, man. When I would see a younger person who would get a knee replacement, and then they would get through the rehab and come back as a patient, dude, they were aged significantly. I don't know if it was that one patient or what, but it seems like that was pretty common. I mean, you get a knee replacement, you have to go on, it's standard procedure to go on blood thinner at 40? I wasn't doing that. So I didn't know what I was going to do. I thought, well, maybe if I choose a different profession. I thought, it was very challenging to me to go, well, if I go through another professional school, I wonder if I could do it. So I decided to go to pharmacy school. Not that I was into pharmacy. I always liked chemistry, but there was a pharmacy school about an hour and 10 minutes from my house. So it seemed like, and I thought pharmacists, they're not going to wrestle patients all day. Maybe I could do it. I got through about 2/3 of it, and where you go on rotations and start following pharmacists around and actually doing the work, and I found out I was going to have trouble. I was got to stand for like 12 hours a day. I couldn't do it. So fortunately, I knew you. You had come back to the area and started a regenerative medicine clinic and called me out of the blue and said you had heard that I had some knee trouble, invited me down, and man, that changed my life. That turned a totally different trajectory of my life. You offered me a job at the regenerative medicine clinic. I jumped. I thought it was the coolest thing, and not to mention I had amazing results with it. So I was like, wow. And I worked with you until we ended up closing that clinic. And man, I'll tell you, that was the highlight of my career. It was so fun. It was the coolest thing. I've never dealt with such amazing success, amazing results we saw, incredible. We would save patients left and right from having joint replacements.
So Dr. Dan, tell us, where do you see this channel going? What are the topics that you see the channel covering?
The idea behind the channel is for people to get one of two things, if not both. One, here's a couple guys who have had injuries, and I want to ask you about yours in a minute, and have been able to come back and get in some type of shape. And so, I think people can relate to that. I think if there's an inspiration story there that people go, well, if those guys can do it, so can I. And then also, we're sort of teachers at heart. Doctor means teacher. And I've always been a coach. Really love doing that type of work and encouraging people and teaching them how to do it. So, if people, look, if you want to get in shape and don't know how to do it, this is the channel to come to. We will show you exactly what we're doing. Every single thing that we promote and teach on our channel, we're doing it. We're doing it together. We've tried it on other clients. We're doing it. We know what it feels like. We know what you're going through. We're not going to have you doing something that we haven't already tried. So, Dr. Beau, what inspired you to get into this? How did you get into Two Fit Doctors?
Wow, how much time do we have? I feel like as I look at the anthology of how all this has happened, so many things in my life seem like they've happened for a reason. And as I look back and I look at, growing up and being born in the 60s and, being a teenager in the 70s and the changes that we've experienced and seen in technology, it's mind-boggling. And thinking about, growing up as a skinny kid in Georgia and wanting to play ball, wanting to be athletic, but just kind of being the runt, And it took a while. I remember asking my mom so many times, Mom, when am I ever going to fill out? When am I going to grow? And it just seemed like it took forever. And I started working out when I was in junior high. I started putting on weight. It was slow, but it did start happening, and my metabolism was just super, super fast. So probably very much like yours. And by the time I got into high school, I wanted to play football, and being in 10th grade and being 105 pounds and being 5'5" is a little hard to see yourself playing high school ball unless you're just extremely fast, and it just didn't work out for me. But I did stay with my weight training, and after high school, I didn't jump straight into college. I waited a year and had really fell in love with bodybuilding and learned that if I really packed on the weight in terms of food, eating, that I could stimulate my body to grow. And, I found myself eating 10,000 calories a day, literally a full meal every 2 hours in order to put on weight. And I finally started to grow, started to get stronger, and then kind of really fell in love with bodybuilding. And the great thing about bodybuilding is it helped me to set goals, helped me to see that I could achieve things in my life. It helped me to see that, there weren't as many limitations as others would, place on you. A lot of those were just in your own head, in your own mind. And to see that, there wasn't much that I couldn't do if I put my mind to it. Mm-hmm. So that was one of the things I think that really helped me. So I've had this passion of weight training, not bodybuilding per se, but always trying to grow, trying to get better, and being on top of my health for 40 plus years. And the entire time that, we've also practiced. And, I got into chiropractic school kind of on default. I got into chiropractic school because I was going to the University of South Carolina. I was pre-dental, and at the time I was weighing 240 in college, and I was bodybuilding at the same time, and still had passions or aspirations of becoming a pro bodybuilder maybe, and then I started having injuries in the gym. I had an injury where I tore my left pec major. I had an injury where I ended up having an aneurysm, and I was on a sled, an inverted sled, and pushing like 2,000 pounds on the sled. And at the time, I mean, I had 34-inch thighs, you know, and a 29-inch waist. And I never squatted 700 pounds like you, okay? But I did squat like right at 595. And
Oh, is that all?
so,
That's pretty good.
but you know, big difference between powerlifters and bodybuilders and how we train. But I remember when I had that aneurysm, and I just started thinking, as you and I have discussed before, you kind of reach a point where the injuries start coming faster, and you start thinking, I've worn out my manufacturer's warranty, you know, and how much more do I have to do, or what else do I have to suffer before I realize something's got to change in order for me to continue to train. And fortunately, this was at the point where, you know, my career had taken over, and you know, it's all consuming chiropractic school, very much like medical school or dental school. And so all of the focus went into my education. And, you know, we still squeezed in workouts when we could, and all throughout school. And, you know, when I got out of school and started practice, it wasn't long after that where you were just getting ready to get out of school, and you actually came on board and working for our clinic, and you were my first intern. So we've had this relationship for a long time, and I used to joke with you then about being Little Doc. But I knew you had been training, and you got serious in the powerlifting side and continued then. And I still continue to train, but I really didn't, I wasn't pursuing bodybuilding anymore. I kind of gave that up. But fitness was still a passion. And I got involved in martial arts, and in martial arts I learned that I could have many more injuries than what I suffered in bodybuilding. And so I ended up breaking my right wrist, broke my right elbow, tore my right hamstring, and I think I had 2 shoulder tears in it. So the injuries just continued to come. And, you know, I stepped away for a while and went and practiced out of state, and then decided to come back here. And when I did, went the route of opening an integrated practice. So we had a very large chiropractic medical practice where we were doing a lot of regenerative medicine, and that's when I invited you to come back and be part of the team, and I'm glad you did. We had a very successful time with that, helped a lot of people, saved a lot of people from joint replacement. But I think the thing that was more beneficial in many ways was the fact that we learned that there were, based on technology, there were a lot of other things that were coming up that were going to be beneficial for us to continue training and continue what was always been a passion and a foundation of ours in fitness. And in doing that, you know, we found out that, yeah, I had several rounds of stem cell. I know you did that in your knees, and it made huge difference for you. We're both still training, able to do the things we want. We're both, you know, people that have used everything from PRP to even doing peptides today. Peptides have become the new big craze, which we, you know, fully endorse. So with the advent of all of this technology and us melding together and starting to train together, I started realizing that one of the things that I had not focused enough on was really, despite having great mentors and teachers like Mike Carberry and like Janet Travell's teaching. If you haven't studied some of her stuff, it's really phenomenal. One of the things I recognized is this, what we were teaching patients in rehab, strengthening all the erectors of the lumbar spine, cervical, thoracic spine, taking them away from that anterior dreaded head carry and that anterior leaning gait that patients would have. And I didn't really understand until we got deep into that how much that was taking away decades of life from patients. So now with you and I actually training together, both being in a semi-retired situation for both of us, and having the time to train again and pooling our knowledge, I've recognized this concept of building an iron posterior chain is really unique. There's not many people that really sing the virtues of it, and even for people that are personal trainers and athletes and influencers and even, you know, authorities in and of themselves, they still don't seem to really value and understand things to the level that I think we do now in terms of the sheer significance and importance of developing that. Because now that I've done that, despite having to go through lumbar surgery, I went through L4, L5 surgery back in 2019, right at the beginning of COVID. after dealing with about 10 years of severe low back pain. And everything we've done conservatively, from chiropractic to spinal decompression, non-surgical decompression, to a lot of the other things we've done, just was slowing it down, but it never really was able to stop it. So finally, after watching my stenosis and get so bad that my left leg was limiting me from being able to walk even, and be able to see patients on a daily basis, I decided it was time to consider something surgical. So I did end up having a neurosurgeon do surgery, and it was minimally invasive. They went in, removed the spurs, and my stenosis, of course, was gone. Well, that was truly life-changing for me. But as we know, with many surgeries, they end up being something that you start one, and next thing you know, a large percentage of people are going to have another one in the next 2 years. And people that have had one or two usually end up having 3 or 4. Mm-hmm. So they have a whole category called failed low back surgery syndrome for people that have had repetitive low back surgery, because it just continues to worsen. And that's not everybody, fortunately, but that tells you, despite our technology and the qualifications of our surgeons, it tells you how difficult it is, to get that right, because there's so many variables. And one of the things my surgeon said afterwards says, make sure you do no deadlifts after this.
Okay.
And I valued her opinion, respected her greatly, know where she was coming from. But many surgeons, I think what happens is they end up, they've spent so much time in their education, getting their education, and that they don't always have a lot of real world experience in some of the recommendations they might make, even though mechanically, scientifically, it might make sense. But the truth of the matter is, when you and I started training together, I went back to deadlifting.
Yeah.
And what I found is, in the deadlifting and everything that we've done, I found out that I've only built more and more stability within my spine, and it's been the entire posterior chain, all the way from C1, C2, all the way down from the neck, thoracic, and lumbar spine. And all of that has made me much more injury resistant and made me much more durable, and I've become stronger.
Yeah.
And I just celebrated my 60th birthday. So for me to be able to do that at the age of 60, especially with the number of injuries that I have, I know that we have a lot of content to share with you to help you be able to train, grow, and thrive at any age.
I think so too, man. Yeah, no, I love it. The information that we have with the experience of the chiropractic treating patients over the years, the rehab knowledge that we've got, and then plus, an effective training system that we are doing ourselves.
I think it does that. I think too, one of the benefits is when we look at a lot of the trainers, we look at a lot of the specialists that are out there today. We look at a lot of the influencers even. You look at the area of powerlifting as well as CrossFit that's become so huge. And you look at, bodybuilding. I think the people that have it probably done the best job of figuring it out in terms of a functional situation are the CrossFit trainers. I think when it comes to CrossFit type training, the benefit is it helps you day in, day out from a functional state to be able to do the things that you want to do and need to do throughout your life or your occupation, but also to be able to be more injury resistant in doing so. And I feel like that's what's helped us the most in some of the training that we've done to really brand and create this iron posterior chain training that we've done.
Our channel has really 3 legs to its stool. One is fitness, and we focus a lot on weight training, but we also will talk about cardio and some different aspects of how to get in shape. So a lot of that will be how to get stronger, how to prevent injuries by making your posterior chain stronger, but also how to get in shape, how to lose body fat, we want to inspire people to get rid of their dad bod. Let's challenge each other. Let's get stronger. Let's get more fit. So that's one leg. And then another leg is nutrition. I really like performance nutrition. So I do a lot of weight loss clients. I really prefer and love the extremes. So I love trying to help a bodybuilder get ripped, But when you do that, it makes all the rest of it really easy. They go, well, I just want to lose weight. I'm like, honey, I'm employed by NASA. That's a peanut butter sandwich. That's easy. That's not a problem. But we really like performance nutrition, but we will also talk a lot about nutritional aspects of how to get in shape and how much protein you need to eat, and how to make good nutrition become a part of your life. A lot of people, they just don't know how. If you don't know how to do it, you don't know when or where to do it, dude, watch these videos. You need to watch these videos. And finally, our third leg of our stool is, I don't want to coin it as general information because it's coming from our perspective. So we want people to use this information to prevent injuries. We want them to know what's the latest stuff out there. We're going to put information out there in these general topics of, getting in shape and healthcare. We want to help people make good healthcare decisions regarding what to eat, how to train, what do I need to do for this problem. We'll talk about stuff like that.
Supplementation, sleep science. I mean, there's so many things that we can get into that will benefit and have an immediate effect on your life and your well-being.